Hiatus hernia, also called hiatus hernia, hiatal hernia or hiatus hernia. Herniation of the upper part of the stomach from the abdomen to the thorax through the esophageal hiatus of the diaphragm. Anatomy of the diaphragm showing the esophageal hiatus. This condition mostly occurs in people who are over 50 years old. It affects up to 60% of people by the age of 60 years. The Esophageal Cancer Awareness Association. Causes. The exact cause in many patients is unknown. Congenital abnormally large esophageal hiatus or injury or other damage weakening the muscle. Too much repeated increased intra-abdominal pressure, coughing, vomiting, straining during bowel movements, and lifting heavy objects. Other causes include obesity, aging, and smoking. Types: sliding paraesophageal hernia, fixed, sliding hiatal hernia. It is more common the stomach and the esophagus slide into and out of the thorax through the hiatus. It tends to be small. It is usually asymptomatic. It may not require treatment. Sliding hiatal hernia. Paraesophageal hiatal hernia. Less common. Part of the stomach herniates through the hiatus and stays there. Most of the cases are not serious. Strangulation of the herniated part of the stomach may occur. This strangulation, if happened, is serious and is considered as an emergency. Paraesophageal hiatal hernia. Symptoms. The symptoms are rare even for paraesophageal hiatal hernia. Any symptoms, if present, are usually caused by HCl, bile, or air regurging to the esophagus. Common symptoms include heartburn, become worse on leaning over or lying down, chest pain or epigastric pain, dysphagia on swallowing, and bleaching. Hiatal hernia and GERD. Gastroesophageal reflux disease, GERD, occurs when the food, liquids, and acid in the stomach regurge to the esophagus. This can lead to heartburn or nausea after meals. It is common for patients with hiatal hernia to have GERD. However, that doesn't mean either condition always causes the other. The patient can have a hiatal hernia without GERD or have a GERD without a hernia. Diagnosis: X-ray with contrast, barium sulfate, endoscopy, sliding paraesophageal hernia, radiograms, endoscopic photographs. Treatment: most cases of hiatal hernias don't require treatment. The presence of symptoms usually call for treatment. Acid reflux and heartburn are treated with medications. Surgery is done on failure of medical treatment. Medical treatment: start by simple medications, antacids to neutralize gastric HCl, H2 receptor blockers to lower acid production. Proton pump inhibitors to prevent acid formation from the start. The treatment gives the esophagus time to heal. Surgical treatment. Surgery is indicated on failure of medical treatment. Surgery is not commonly recommended. Rebuilding the weak esophageal muscles. Open or laparoscopic hiatus narrowing and fundoplication, wrapping the gastric fundus around the lower part of the esophagus. Uh, Hernias can recur after surgery. This possibility can be reduced by staying at a healthy weight, no lifting of heavy objects, avoiding strain on the abdominal muscles. Fundoplication, changing the lifestyle, eating smaller meals several times a day instead of three large meals. No eating meals or snacks within a few hours before bed. Other ways to reduce the symptoms: no smoking, raising the head of the bed by at least 6 centimeters, 6 inches, 15 centimeters, avoiding bending over or lying down after eating. Reducing the risk of hiatal hernias. Patients may not avoid a hiatal hernia entirely, but they can avoid making a hernia worse by losing excess weight and no straining during bowel evacuation, avoiding lifting heavy objects, avoiding tight belts and certain abdominal exercises. Good luck and best wishes.